Are herbs safe during pregnancy? Many medical professionals warn against using any herbs before, during, or after pregnancy. Their objections range from the valid inconsistencies of the quality and potency of the products and manufacturers here in the U.S. to a supposed lack of research and testing. I spoke with Angela Hywood at the MediHerb seminar I attended in Brisbane, Australia. Here's what she had to say about all of that. Hi everyone, I'm Dr. Mark LeMay, and we're here in Australia, actually Brisbane, Australia, with Angela Hywood. And Angela, could you explain to them what are some of your credentials and what kind of practice you have?
Yeah, sure. So I'm an Australian trained naturopathic clinician and a pharmacist by first profession. So I've got 2 university degrees, and that was 8 years of clinical study. And I've currently just started my master's as well in complementary and alternative medicine. And I'm a specialist in women's health, reproductive medicine, preconception, fertility, and mums and babies. So that's what my practice is all about.
My gosh, it's like she is a wealth of knowledge here. So one of the things that our patients back in the United States always are telling us is that they're being told that they are not to use herbs while they're pregnant.
Right.
So could you kind of address that issue a little bit?
Yeah, absolutely, because it's one of the issues I have to address with every one of my patients and their obstetricians as well. Our international guidelines on herbs and the education about toxicology is actually quite rich. We have a lot of information about that. And there's categories of safety of herbs in pregnancy. They go from category A being very safe to X, which means, they're not safe to take.
Correct.
And this is based on toxicology, human studies, and animal studies as well. Now, these are the very same drug categories, that drugs would fit into in terms of safety in pregnancy as well. So we do have around about 30 or 40 herbs that are between levels of evidence of A, B1 and B2, which are considered safe for administration through pregnancy and breastfeeding. So what I like to say to women is they're in good hands with a well-educated practitioner. I can show them textbooks to show them evidence of safety. I write and have conversation with their obstetricians. And I don't just prescribe them just because. I prescribe them because these girls have come to me with a problem that needs resolving, that there may not be a drug that's safe for their pregnancy to use for that situation.
Correct.
So I think it's all about keeping lines of communication open, using evidence-based medicine. It's very important here. But the answer to the question in short is yes, we do have herbs with safety profile that absolutely can be used when needed in pregnancy.
Yeah, and it's more of an education process,
It
both
is.
with the patient and also with their prescribing doctors too.
Absolutely.
Because I know the doctors are looking out for the the health of their patient.
Of the mother
exactly.
And the child.
So so good. I'm glad we got that. So could you give us kind of an example of give me a case study of some patient you've recently helped that came to you?
Yeah, absolutely. And I've got a good pregnancy case to talk about here actually. A gorgeous girl came to me when she was just thinking about conceiving again. She has one child and she got severe prenatal depression in her last pregnancy.
Okay.
And it was incredibly debilitating for her, and her postnatal experience wasn't great either. She didn't want to go down the route of pharmaceutical drugs because she's more holistically minded, and also her obstetrician didn't want her to go down that path either. So he actually recommended she maybe change her diet, do more exercise, see a psychologist. So she did that, and the psychologist then referred her to me. So we did preconception healthcare thoroughly and well to prepare her. She fell pregnant easily. And then I said, look, when you are pregnant, I will continue on some beautiful botanicals that are safe in pregnancy to help ensure you don't get prenatal depression or postnatal depression again. So Withania somnifera is the major herb that I've prescribed her, which is a beautiful adrenal adaptogen, has anti-anxiolytic effect, is category A, safety in pregnancy, And I've
Thing
really
is beautiful, beautiful herb.
It's a beautiful herb and really well supported her nutritionally through her pregnancy as well. And she's just expecting to deliver literally any day now. And feeling great.
You have to tell us how the outcome is.
Absolutely. And she's been really feeling great and really well
good.
supported, you know, emotionally, physically, biochemically through this pregnancy. So far so good.
Well, great. Well, thank you for sharing that story, because again, that's going to be very helpful for our patients, because again, we just want to educate them better about the safety of what we're doing here. So again, Angela, thank you very much for taking some time to just talk to us and our patients. We really appreciate that.
Thank you.
It was really cool to hear about Angela's patients getting such a wonderful outcome from taking herbs before, during, and after her pregnancy. And as Angela said, herbs are well studied, researched, and categorized for different levels of safety, and are usually safer than medications during pregnancy. But sadly, herbs are not regulated here in the US. But they are highly regulated in Australia, which is where MediHerb is located and why we use MediHerb products in my practice. I've been to their lab and their manufacturing facility, and I saw for myself the extensive testing they do. Stay tuned for an upcoming video on that. But there are potential risks. Just because something is natural does not mean that it's safe. Herbs can be perfectly safe, like Angela said, under the care of a qualified healthcare practitioner. So if you know somebody who wants to have a baby, is about to have a baby, or who just had a baby, send her this video and encourage her to give us a call. I'm Dr. Mark LeMay. Thanks for watching.